And keep 2 yoga blocks nice and close where you can reach them. So we'll start out in our tall seat, lining everything up, and then as you exhale, scoop the pelvis under, draw the belly button back, roll yourself down with that control. Draw the shoulder blades underneath your back and lengthen your neck as you place yourself down. Now we'll start out with a way to open up the lower back that I really like to do, because we do so much external rotation in yoga that we don't really do a whole lot of internal rotation. So I'm going to take my knees together, walk my feet out to the sides, and be really aware that I'm pressing my tailbone out. I don't want my hips to pop forward and exaggerate this lower back arch. Drawing down with my lower belly and just letting that open the muscles around my hips from my lower back. Now if this is uncomfortable on your knees at all, definitely back out of it. An option is to take a block and settle it underneath your legs so you have something to rest on. And that'll give you a little bit of opening. It won't be quite as intense, but hopefully that should take some of the discomfort out of your knees, because we never want any discomfort in our knee joint. And then the arms come up toward the ceiling, and you just cross the elbows, drop the hands around like you're giving yourself a hug. Couple nice deep breaths. Letting that open from the upper back as you walk your fingers around, letting the knees just drop in towards center. And then we'll switch the arms, take the opposite arm on top, walk the fingers around. Take your arms up, start to walk your feet in. And then we'll reset the spine. Just set the pelvis down onto the mat so that there's that natural lower back arch. You should be able to slide your fingers underneath, but there isn't a whole lot of space in between there, just a little bit. Then take your hands, interlace your fingers to make this nice hammock. Bring that to the back of your head. We slide the thumbs up the neck until we find what's called the occipital region, which is got a little bump on either side of the back of the skull. And it's right about the place where your spine and your skull come together. The muscles there get really tight from holding up our head all day. So I'm just taking my thumbs into those spots and making little circles. And it's basically just about finding a place that feels good, that feels like it's tight, and it needs a little bit of pressure. And then I'm starting to create some traction, very gently drawing my chin down toward my chest. And I keep making those little circles in the occipital area. I should say the suboccipital area, right below those occipital bones. And you can go out to the sides, just kind of explore with the thumb, see where it's tight. Then we'll very gently start to rock the head from side to side. All of this movement is coming from my arms. I'm not doing anything with my head. I want my neck muscles completely relaxed as the head just rolls. And we'll come back into center and do the same thing to nod the head up and down very gently. All of this work is coming from my arms. My neck is totally relaxed. A little rock side to side. A little nod. No pain with any of this. We have to be really gentle when we're moving the neck because we're working on small muscles, really small structures, and a lot of nerves, very important nerves that come out from this area of the spine. Okay, place your head back down. Make sure that you have this nice lengthened space with the neck, and you'll know when your throat is really open and it's free to breathe. It's like if you ever take a CPR class and they have you reposition the dummy's head so that the air can go in and out. If the chin is tipped up, it's going to constrict the airway. So drop it back, lengthen through your neck. Create that freedom for the air to come and go. And then without the hands, we're just going to do that rock from side to side, using as little effort as you possibly can. No tension in the muscles. center. Take a deep breath, feel that alignment, let your shoulders melt down into the mat, and you can even open your palms up to the ceiling, drop your thumbs down toward the floor. That's going to help to roll your shoulder blades under your back more. Creates more opening in the chest, gives some more space into your neck. Okay, now we're going to move down to work on the lower spine. We're going to inhale, roll up into a bridge. Exhale, roll it down. Now I want you to get as much curl through the lower spine as you can when you do this. On your exhale, drop your belly button, totally flatten that lower back arch. Inhale, peel from the tailbone up. Lengthen your tailbone out here. Exhale, roll it down. So I'm going from the top down, really scooping my lower belly all the way through my lower back, and then the pelvis releases and I find that natural back arch again. Exhale, roll the pelvis back, flatten the spine. Inhale, roll it up. And then exhale, roll it down. Okay, so that was our full bridge. This time we're going to do like a little mini bridge. We're going to press into both feet, press into the arms, and just lift the hips a few inches up off the mat. And this is going to give me a little bit of freedom to do some movement with my pelvis. And I'm going to drop the right side of my pelvis down, and then lift it up. Drop the left side down, and then lift it up. It's a little rocking side to side. Drop, and lift, and then drop, and lift. And you might feel a little bit of opening through your lower back muscles. It's a very gentle twist coming from the lower spine. If you get into a spot where you feel a little bit of opening, stay there and take a few breaths. After you've gone back and forth a few times, we'll come back into that lifted position, totally level, a few inches up off the floor, and we're just going to sway the hips side to side. It's like you're rocking a boat, side to side. And the way that you really make that happen is I'm pushing into my left foot, and then pushing into my right foot, back and forth like that. Little movements to free up the muscles that stabilize your pelvis, that connect your pelvis and your lower back. This is why a lot of times when we have tight hips, we also have back pain. And one more little rock. Side to side, back into center, roll it down. Let's pull our knees into our chest. This is a really good way to open the lower back. And you can rock side to side if you like a massage across the muscles. Okay, next one is one of my absolute favorite movements for when my back is hurting, or if I've been on a really long road trip. I'm going to take my block and slide it underneath my hips and bridge. I'm going to do that same setup, tip the pelvis back, roll up from the tailbone, lengthen out through my tailbone to open some space in the lower back, and then I slide the block directly underneath my sacrum. Make sure that you get the fused part of your back. There shouldn't be any vertebrae that can move that are getting pressure from the back, from the block. So make sure that you find your hip points and then go down, and there's my block right there. It's actually even a little bit lower than my hip points because that's the top of my pelvis. And then it's just a matter of sinking your hips down onto the block with really full exhales to create that settling. And I'll stay here, if I'm really having back pain, I'll stay here for probably 5 to 8 minutes, just working on breathing and settling until sometimes I'll get a little pop in my back as things slide into place. And I'll start to do some leg movements to help that process along, just drawing one knee into the chest and then the other knee. And you can straighten all the way up to the ceiling. Sweep it down. This is going to give you a really nice opening through your hip flexors. Now if your hip flexors are tight, this might pull your lower back forward a little bit more than we want, and you might need to keep your knee bent to have a safe curve in your lower back. But just see how it feels when you straighten that leg out. Should be a nice, comfortable opening through here. Sweep it back up, fold it in, and then the left leg up and out. Go really slowly. See if you can go all the way straight or if you need to stay with a bent knee. Take your exhale, let your hips settle even deeper. Draw the left leg up. Face it down. Okay, now just check that that block is really stable underneath your pelvis, totally balanced. And then we're going to pull both knees out. So the block should still be totally flat. Don't let it go onto an angle at all. Take both legs up to the ceiling. This is a pose that I do with my students a lot. If they don't like to do full shoulder stand, this is a really good option to still get all those benefits of the inversion, helping circulation to come back to the heart and all that good stuff. But gives really good pressure into your sacrum. So if anything, the SI joint is out of whack, if there's a lot of tightness around the pelvis, this helps some of that to settle. It's also good for your digestion because we have that bit of an inversion through the belly. And you can do some little foot movements to help that circulation. A little bit of circling, pointing and flexing. Draw it back down. Now, if you can go straight with the legs, we're going to go all the way out into an extended bridge. This can be pretty intense, so if you need to, keep your knees bent. But let your legs relax, let your toes drop out to the sides so that the muscles in the hips aren't working here. We want them really soft so that anything that's out of alignment is going to pop back into place naturally. When the muscles stay tight, they're holding that misalignment. They're preventing things from going back into natural alignment. That's what we're trying to let go of here. Maybe you can walk your shoulders a little deeper underneath your body. Open up through the chest. And we won't stay here too long, but if you're doing your own practice, feel free to stay here for several minutes. If you feel like you have tight hip flexors and that's causing you back pain, this is a good pose to spend some time in. We'll start to walk the feet back into that regular bridge. Release your shoulders if they were under the back. And very carefully start to lift your hips up off the block. Slide the block out and roll down. Use your abs to place every vertebrae down individually. Release that natural lower back arch. Draw the knees back into your chest. Rock side to side if you like. Okay, let's roll it over onto our side so that we can come up into sitting. And then I want to do some work for the spine. And this is a way that I like to break down cat and cow, so that we get the most movement and the most activation through our muscles. And we're just going to start by doing a 3-part segment. We're going to start with the hips, rock them forward, and rock them back. Try to keep your rib cage and your head and your chest as still as you can. There's going to be a little bit of movement, but try to put as much focus as you can into the pelvis, rolling forward and back. And what I want you to feel out of that movement is how important the abs are for creating this tuck and then release. So it's a contract and relax. And of course we're working in combination with those lower back muscles, which are really important. So belly contracts, back opens, and then back muscles contract, belly opens. That back and forth, totally coordinated. Now let's take that up a little bit higher and put the chest and the shoulders and the rib cage into it. And that's when it's really strong with that movement through the abs, because we're doing the top of the pelvis to the bottom of the rib cage. Stretch and contract. And try to get the same thing with your shoulders. Squeeze them back as hard as you can, and then press them forward. And then let's go all the way up into the head. Full front body contract, and now full front body opening. Okay, now once you feel like you have a pretty good handle on that movement, we're going to flip that over into table and do the exact same process. Start with just the pelvis. Rock it forward, pull it back, tuck the tail under. Everything else is still. Now move that up into your rib cage. Pull the ribs back and then drop them down. And let's take that all the way into the head, tuck the head under, and lift it up. One more breath like that. And then we'll open the knees wide. Bring the big toes together. Drop into child's pose like that. This is a much straighter child's pose than when we have the knees together. We're getting more extension, more length out through the body rather than rounding. And we'll take our inhale, walk the fingers a little bit farther forward on the mat. Create this traction down the side body and down the spine. And then we'll just rock the head side to side very gently. Make sure the neck hasn't taken any tension. Take your inhale, come up into sitting. We'll bring the legs out front. Now for the last one, I want to do a nice spine release with the blocks. And the way that I like to do this is with one block right on either side of my hips. And it's a pretty comfortable position that I can push into my hands. If you need to, you can go into fists. I'm going to push and lift up until my pelvis is totally suspended. And then I can do a little bit of rocking side to side. And some movement front and back. And it's up to you if you want to keep the knees bent or if you want to straighten them. Side to side, front and back. Good. And then I do a little bit of like a jostling up and down. And that creates some good traction, letting the weight of my hips pull down on the spine to create some lower back traction. So that was our decompression sequence with some variations in table, variations in bridge, and some sitting variations. So hopefully that has created some space through your spine. Namaste.